My presentation is on hospice care organizations by Keila Herman for Health Information Management 2810, Fall Semester 2018, under the direction of Professor Julie Shea at Santa Fe College. What is hospice care? As defined by the Hospice Foundation of America, hospice offers medical care toward a different goal, maintaining or improving quality of life for someone whose illness, disease, or condition is unlikely to be cured. According to the National Hospice and Palliative Care Organization, hospice care is quality, compassionate care for people facing a life-limiting illness or injury. Hospice care organizations provide services to patients who are at the end of their lives. Hospice offers medical care that maintains or improves the quality of life for individuals whose illness is unlikely to be cured. Individualized care plans are created to address the physical, emotional, and spiritual needs that accompany terminal illness. Hospice services are offered to people when curative measures have been exhausted and prognosis of life is 6 months or less. Federal and state laws and guidelines determine hospice admission, use, and service. The majority of hospice organizations follow Medicare requirements. To manage the illness, a patient can receive medication for symptom control and pain relief, physical therapy, dietary counseling, medical equipment, and short-term inpatient care when pain and symptom management cannot be adequately achieved at home. Hospice also provides grief counseling for the family members and loved ones of the patient. Description of hospice care organizations: provides services to patients who are at the end of their lives, offers medical care that maintains or improves the quality of life. Hospice services are offered to people when curative measures have been exhausted and prognosis of life is 6 months or less. The patient can receive medication for symptom control and pain relief, physical therapy, and medical equipment. Grief counseling is also offered to the family members and loved ones. Example of a hospice within 100 miles of Gainesville will be the Community Hospice and Palliative Care of Jacksonville, Florida. Community Hospice and Palliative Care is located in Jacksonville, Florida, and provides care to those who are in the final phase of life. Established in 1979, Community Hospice and Palliative Care has a 38-year history of providing care to adults and children in Baker, Clay, Duval, Nassau, and St. Johns counties. Since its inception, nearly 200,000 patients have been served. Services are provided by more than 950 employees and 1,000 volunteers to approximately 1,500 patients per day. Care provided by Community Hospice and Palliative Care is individualized and based on input from the patient, the physician, and family members. Hospice care can be provided to any person with a terminal illness, including Alzheimer's disease, liver disease, Parkinson's disease, congestive heart failure, stroke, multiple sclerosis, and chronic obstructive pulmonary disease, just to name a few. Because hospice is provided once an individual is at the end of life, life-saving treatments are not offered. However, chemotherapy and radiation may be administered if they provide comfort. Each patient is unique and care is coordinated with the patient's physician. The physicians and advanced registered nurse practitioners have extensive training in pain management and symptom management. Psychosocial professionals tend to the patient's and patient's family members' emotional and grief needs. The cost of hospice is covered by Medicare, Medicaid, and private insurance plans. Community Hospice and Palliative Care is a nonprofit organization that provides care regardless of an individual's ability to pay. The hospice facility must have a governing body and establish written bylaws for the governing body. Duties of the governing body include defining eligibility for hospice services, comprehensive emergency management plan to protect the safety of patients and their families, and an annual operating and strategic plan and budget. Each hospice must appoint a committee to develop and implement a comprehensive quality assurance and utilization review plan. The quality assurance and utilization review must be in accordance with standards incorporated with Medicare conditions for participation. Incident or accident reports are required for every error or adverse reaction in treatment. The Quality Assurance and Utilization Review Committee is also responsible for auditing patient records on a regular basis. Accurate documentation is a must. Hospice providers must accurately document patient care to ensure proper documentation of Medicare-covered services. Documentation to support hospice admission includes change or deterioration of condition that precipitates hospice referral, physician assessment, diagnostic documentation to support life expectancy of 6 months or less, and patient or the representative has elected hospice care. To support the necessity of hospice services, documentation should include change in the patient's weight, worsening lab results, change in responsiveness, skin integrity, change in pain, and changes in signs and symptoms such as oxygen rate and edema. Prior to submitting a claim, the hospice must make sure the election statement was signed and dated prior to beginning of care per Medicare regulations. Medicare hospice benefit requires patients to submit a notice of election and a claim. The notice of election is submitted after the beneficiary has signed the election statement. The notice of election must be submitted to a Medicare administrative contractor within 5 business days of election of hospice coverage. Hospice claims must be billed separately, sequentially, and the first claim may only be submitted after the notice of election has been processed. Only 1 claim is submitted per month. Within 5 calendar days after discharge or revocation, a notice of termination or revocation must be submitted. Hospice is funded by government programs, private insurance, and grants donated by charitable organizations. Payment for hospice care is reimbursed on a per diem basis. The number of days a patient is enrolled in the program and receives services determines the payment. Nonprofit hospice facilities can solicit charitable donations, while for-profit hospice organizations can only receive donations. The Agency for Healthcare Administration issues licenses to operate a hospice facility. Licenses are issued to any non-for-profit public agency that meets all federal, state, and local requirements. The applicant for a license, if successfully approved, must submit the names and professions for the care team along with license information held by the care team no later than 3 months after the license is issued. Hospice follows guidelines provided by International Classification of Diseases 10th Revision Clinical Modification. Hospice providers cannot report diagnosis codes unless they are used as the principal diagnosis. Hospice care centers must follow the official guidelines for coding and reporting diagnoses. In conclusion, hospice is an important type of care that is provided to those with terminal illness. There are many laws and rules concerning hospice facilities, coding, and certificate and licensure. The laws and rules are designed to assist and protect the patient and the provider. Cost of hospice is covered by Medicare, Medicaid, and private insurance. Guidelines are in place to determine if a patient is eligible for hospice services. Hospice care is not curative and that the treatment will not cure the disease. Hospice treatments are designed to provide comfort and pain relief to those in the final stage of a terminal illness.